Today, talking about psychotherapy outcomes. Very important presentation to describe some of the really simple aspects of how we do our work and how important it is to keep all of that in mind. So, effective psychotherapy has been a hot debate for decades. In other words, really what works and which intervention works the best. But the outcomes research has not supported the notion that any specific therapy or techniques are a major contributor to clients' progress, especially when compared to the contributions made by the therapeutic relationship. The promotion of empirically supported treatments may lead us to inadvertently overlook some consistent findings of psychotherapy outcome research that the therapeutic relationship is the vital thing contributing to client progress. Very clear, it's about the therapeutic relationship. The research on psychotherapy outcomes has examined the relationship between a host of other variables and other things related to client progress. And they are basically extra therapeutic change, common factors, expectancy, and techniques. And here is a chart basically of what some research showed on those four different parts of psychotherapy outcomes. Or 40% has to do with extra therapeutic change. 30% common factors we'll get to in a second. 15% expectancy, and 15% only for techniques. Now that may be discouraging in a sense. You're taking this class all about interventions, and they are vital. But really, 15% of outcomes, positive outcomes, were related to the specific techniques used. So extra therapeutic change, basically spontaneous remission, fortuitous events, and social support. So meaning someone comes to you for help and then suddenly they just get better and they're doing fine and they decide not to come back. Or something happens, fortuitous events like they get a new job and they're much happier because of that, and or their money situation has improved a great deal. Or social supports, suddenly there are just better people in their lives, or there's been a change, so there is a really wonderful support system or person in their lives. Expectancy in terms of outcomes, placebo effects, is just, I'm getting treated, I'm seeking treatment. A lot of people just feel better just to do that, just to make that move to seek treatment. And also the belief that things are going to work. There's hope. Hope is a huge emotion that relates to how we feel in life and how we feel about if there's going to be change or not. And techniques, factors specific to a prescribed therapy such as biofeedback, systematic desensitization, and others. In other words, there are specific techniques that are specifically important that you will use in your practice to help people, and they are specific to outcomes for that reason. But the fourth area, common factors. It's a variable that's found in most therapies, regardless of our or a theoretical orientation. And they are basically empathy, warmth, and acceptance. Obviously, if people come to see us and they do not get from us a sense of empathy, warmth, and acceptance, they are not going to come back. It's as simple as that. And much more likely to move forward, get better, do better. There's an encouragement of risk-taking by attending treatment, and something that we are likely to do. The client and therapeutic characteristics, and I'll get to that in a second. Confidentiality, obviously a huge thing, but a huge part of outcomes is people feel like what they say stays there. You will tell them, we all tell them in the beginning what may cause us to not remain confidential, like their safety, someone else's safety, perhaps a judge asking us, requiring us to appear at trial. Other common factors, but the therapeutic alliance or process factors, and they are, as I said in the beginning, crucial. But the research available to us has led to one basic conclusion that psychotherapy, in general, has shown to be effective. The average treated client is better off than 80% of untreated comparison control subjects. So people seeking treatment is good. It does work. And it does work extremely well for most people. However, recent meta-analytical reviews have not strengthened the case for the superior effectiveness of specific techniques for disorders. Additionally, a number of studies found almost no evidence for differences between major schools. So the practitioners of different schools, still, it was the therapeutic alliance, basically, that caused people to get better, to improve, for outcomes to improve. Not specifically the technique, or the school, actually. In one NIMH study, conclusions showed limited evidence for superiority of the interpersonal psychotherapy approach and no evidence for superiority of CBT above a medication clinical management placebo effect. The two therapies were effective, but the patients who received the placebo treatment also improved similarly. Interpersonal psychotherapy did show some advantage with more severely challenged patients when compared to placebo. So another study telling us that there really does not appear to be a huge difference between the treatment approaches. Spontaneous remission is something to look for, that people suffering from disorders improve without any professional treatment. They never go to seek treatment. They never talk to someone about things in a professional setting, and they get better. The median rate for patient improvement is approximately 43% for the spontaneous remission. Factors that impact the rate of spontaneous remission include the number of organ systems involved, or the severity and complexity. In other words, if not too severe, not too complex, all of us tend to get better without seeking professional treatment. The length of time, so if someone is feeling depressed, if it doesn't last for long, not too deep, spontaneous remission. The presence of an underlying personality disorder or other axis 1. So depression with anxiety, and for a long period of time, much less likely to have remission spontaneously, much more likely to persist and requiring professional help. The nature, the strength, and quality of social support is absolutely vital to whether or not someone gets better after having a brief difficulty with something. And then the diagnosis. Like a diagnosis of bipolar, that's not going to spontaneously have remission. A person's going to have episodic difficulties, including feeling fine episodically, but it should be treated professionally. Research with early responders. It's difficult to attribute improvement in outcome to a specialized treatment protocol with this group because they do not last. They don't stay long enough in such treatments. Rapid response has been noted across different treatment approaches, and this could lend the support to the idea that the contribution of specific techniques may not be as important to client outcome as other factors common to all therapies. Now, like I was saying before, there are a few specialized techniques that are very important and very useful, like exposure treatments for specific phobia disorders. Let's say flying, let's say spiders. This exposure treatment, that's how people, along with discussing issues and feelings and other factors, but exposure treatments are really important. Gradual practice with some sexual disorders, cognitive restructuring and exposure, again, with agoraphobia, and certainly dialectical behavioral treatment for borderline personality disorder. So there are some specialized techniques that you will or you'll want to get to know to use in addition to your practice, or perhaps as the focus of your practice. Like I said before in our last lecture, that it's the toolbox idea for most of us, especially most of us in rural practices. We need to be generalists, advanced generalists with excellent toolboxes who really know how to get and maintain a therapeutic alliance with our clients. Certain therapists are better than others at promoting positive client outcomes. And some therapists do better with some types of clients than others. Do not get anxious about that because it is all about the match. I don't care how good you are as a therapist or how long you've been doing it. If you don't have a match, if you don't feel the connection or they do with you, very likely to have positive outcomes. Clients often attribute the positive therapy outcome to the personal attributes of their therapist. In other words, it's all about the alliance, the connection, and the basic skills. So people will say, oh, that person was so effective for me, when actually it's really about the alliance, that connection, the strength, the I care about you and I believe in you perspective that we provide to our clients when they are working with us. Comprehensive review of the research indications, the attributes of the therapist, your credibility, your skill, your empathic understanding, your affirmation, which is the I care about you and I believe in you of the patient. The ability to engage and keep people engaged during the time you're working with them, whether it's a half hour, an hour, whatever the time, and over time. Focusing on their problems is all about our patient, about our client. As I tell my patients, and that, by the way, I use that word patient. I know most folks, I think, in social work use the word client, but I just feel more comfortable with patient because client seems to me to be a word that people use for accounting and for lawyers and stuff like that. So in the healthcare field, I prefer that word. Anyway, I always tell my patients it's the only one-way relationship you will ever have in your life. All other relationships are two-way, and more one-way than with your doctor. But because when a person is with us, it's all about them. Yeah, once in a while they'll ask how you doing, or they'll wonder about this or that. That's fine. But it is an hour, let's say an hour, it is all about the person, about your patient. And lastly, we are directing our patient's attention to their affective experience all the time. And maybe for the first time in their entire lives is where they're talking about their emotions, their feelings, their emotional system, how they're doing emotionally. And we are directing them to that all the time. Now, I do recommend, don't ask the question, how do you feel about that? Because people laugh. It is the classic therapist question. I do ask the question, so what are your thoughts and feelings on that? As another way to say it. But we are directing people to their affective condition, their experience, all the time. That's what we do. Thoughts are one thing. It's really about our emotions. As I say to people an awful lot, we toil in our thoughts, but we live in our feelings. So we are directing people, our patients, their attention to their affective experience all the time. Therapeutic alliance. The therapist's contribution to this includes the provision of facilitative conditions. It's basically how you are, but it's also the setting, creating an atmosphere that is very accepting and very much facilitates an alliance, a connection. Your ability to deal effectively with ruptures. We always need, once in a while, things will happen in our conversations with patients or something we may do. That conscious use of self thing. If you look a certain way, like disinterested or alarmed or freaked out, your patient's going to see that and respond probably subconsciously to it. So also there are times where you may look like something or say something and people feel like you're disapproving and there's a rupture. You have to be aware of that. You have to get on top of it. You may even have to just call it out, like it looks like you're wondering if I'm reacting in a way that is not quite approving of what you did, and then you want to talk about it. The ability to come to a mutual agreement on the goals of treatment. And you know what? A lot of times, like for main care or in agencies, you have to have treatment plans, and that's great. But a lot of times you just know what people are dealing with. And if you don't know what their goals are, by all means, hey, let's talk about your goals of treatment, because you do want to make sure that you know and they know, together what goals of treatment are. 26% is in a study, 26% of the difference in the rate of therapeutic success was accounted for by the quality of the alliance. Therapy outcome can be predicted by ratings of the therapeutic alliance in the early stages of treatment. And so basically what that is saying is the difference in the rate of success is the quality. So if you really have a great fit, and the patient has a great fit with you, you're much more likely to have success. They're much more likely to find success. You're much more likely to facilitate their success because of a really strong connection. If you feel your connection is weak, I bet you anything you will see, they're not quite as engaged, they're not quite succeeding as much in the therapeutic process. So that alliance is huge. And you will see that in the early stages of treatment. You will just feel it. You will know it. They really feel engaged. They really feel like you're accepting them. They're really starting to open up and talk about this stuff and explore and problem solve the way they need to. So conclusion, psychotherapy is successful in general. 80% of people are doing better from psychotherapy. Comparative studies of techniques consistently report the relative equivalence of therapies. In other words, the tie-score effect. Things are basically the same from technique to technique in terms of outcome and success. Measures of therapeutic relationship variables consistently correlate more highly with client outcome than specialized therapy techniques. It's all about the relationship. And some therapists are better than others at contributing to positive client outcomes with certain clients because it's all about the match. I may not do so well with somebody, but then they go see you and they do great. There's just a better connection, a better alliance. So as folks who have had me as an instructor before, I've been a therapist now for 18 years, and this stuff never changes. I've taught this class for years. This stuff never changes. Yes, you do want to basically have a great toolbox at your disposal, but it's really about the alliance and the acceptance and the ability for your patients, your clients, to move through the change and process they need to do because they feel great in your presence and they feel like they're well understood and well accepted and they can move forward within that. So that's it for this lecture. And again, you'll see a discussion forum with a couple of questions for you to answer and to explore. Take care.